Can you explain what you're doing?
So I'm filling in a mild facial defect in her nasolabial fold, and I'm using Volbella today because Volbella is actually the silkiest of the Allergan products. Gives the most natural appearance. It has a slightly higher price point, but for minor facial features, minor facial contouring, I feel like it's kind of the best way to go. And now I'm just kind of smoothing the product over into the area that I want it to be in. And as you can see, almost immediately she did the dimpling that she was worried about has been filled in. Okay. Fill up. Very first vampire platelet rich plasma facial. The first step is using a liposomal numbing cream, and I choose liposomal because it actually absorbs into the skin a little bit better because it's fat based, unlike some traditional liquid based anesthetics. This actually gives great numbing. I actually have my compounding pharmacy whip up this special version of this numbing cream. It needs to be on a lot less long, so patients only need to be numbed for the actual procedure. They don't need to walk out of here with a totally numb face. So you just kind of apply it very liberally into the areas. We put on a little stylish headband for her to pull her hair back. And as always, we did a thorough history on her to make sure she has no allergies. Because even topical anesthetics can cause allergies, which I've seen. Especially when these procedures aren't administered by a doctor. We put in roughly 2.5 to 3 cc's of this, and this is what breaks down her blood into the components that we need. Is we take the blood mixed with the ACR, which is the separator, and we inject it into this patented needleless syringe to get it prepared for its first spin. And it just locks in, very easy. Just inject it all the way in there.
And what does the spin do?
The spin actually separates, the first spin will separate the plasma into what's called platelet poor plasma, which is PPP. And then we take the PPP and we respin it after I retransfer it into another syringe, and we get platelet rich plasma, PRP, which is the good stuff.
So just explain what it is.
This is the PPP. As you can see, this is the platelet poor plasma that we were talking about. Now we're going to transfer this and respin it.
Okay.
So you see this urine colored substance? That is actually still platelet poor plasma. This is the money right here. You see that little white coat underneath there? That's what they call the PRP buffy coat. That little bit right there, that's essentially, for the layman, that's concentrated growth hormone right there. Specific to your body, non-allergenic, completely natural from your own blood.
And what does it do?
This actually stimulates collagen formation, stimulates revitalization of your face. It actually stimulates new cell growth. So that's the golden, triangle of medicine. If you can stimulate cell growth in dermatological medicine or any kind of dermatological procedure, that's what you want to do. It does take more time. Obviously, it's not going to be instant the way fillers and Botox are, but over the course of time, this will actually make your face naturally regenerate to a more youthful appearance. The PPP with the PRP at the bottom right there. We leave a little bit of the PPP just so we have volume for both injection and to use for the microneedling procedure. So what we do with this now is we can get a little rough with it because we want it to mix. So we we kind of hit it up good, and as you can see, if you've done it right and you have the right concentration, it went from yellow to red. That's the PRP activating when I hit it. So now this is the stuff that goes back into the patient. This is the stuff that makes everyone beautiful.
Are you ready to be beautiful?
Always.
Trauma.
Yeah.
So we're using our custom microneedling pen. We're gonna actually start with very low depth. We're just creating channels. So we're using our custom microneedler to create micro channels where we see the fine lines and the wrinkles. And this is done at the lowest depth just so I can create channels for the PRP to actually get in where and do what it needs to do. As you can see, she's tolerating it very well, but you see the skin turning red. That's what we want. We're getting blood flow to the area. So I tend to do this in sections just to make sure we get good coverage. So we'll start with the forehead and the temple region. And the glabellar region, which is every woman's #1 spot where they want the fine lines and wrinkles. Flora here tells me that she has an overdeveloped glabellar from nasty kids and a mean husband. So we're gonna make sure Flora can't glower at her children anymore. So we're gonna add just a little bit of PRP to these micro channels we just created. And it doesn't take much. That wasn't meant to happen. So we're gonna add a little bit more PRP to her face. We just created the microtrauma.